Stop. If you're over 60 and you think just drink more water is the whole kidney story, you're missing the part that quietly decides whether your kidney numbers drift down or stay stable. I'm going to give you 5 drinks with real research behind them for kidney protection after 60. Not miracle detox, not hype, actual data. And I'll tell you exactly who should be careful, because with kidneys, the wrong healthy drink can backfire if you have the wrong medical setup. Quick reality check. Kidney health usually comes down to 3 pressure points. 1. Hydration and urine flow. 2. Blood pressure control. 3. Inflammation and damage to the kidney's filter, often showing up as albumin leaking into urine. That's why the best kidney drinks aren't exotic. They lower strain, lower pressure, and support the filter. Safety first. If you've been told you have a fluid restriction, heart failure, very advanced chronic kidney disease, or you're on dialysis, do not blindly increase fluids. In that situation, the right amount is medical, not motivational. Now, top 5 drinks, starting from number 5. Drink number 5, plain water used correctly. This is the least exciting one, so most people do it wrong. They chug at night, then wake up exhausted from bathroom trips, or they hydrate with sweet drinks and call it water. Here's why water still makes the list. For kidney stones, urine dilution is one of the strongest and most consistent preventive strategies we have. Concentrated urine is where crystals form and stones grow. So what does used correctly mean? It means steady sipping earlier in the day, not a huge flood at night. It means aiming for pale yellow urine most of the day, not perfectly clear 24/7. And it means taking thirst changes seriously after 60, because thirst can get less reliable, especially if you're on diuretics or you have diabetes. And remember this, water is necessary, but not always sufficient. Water doesn't fix high blood pressure. Water doesn't fix high sugar. Water doesn't undo medication side effects. It's the foundation. Then you build. Drink number 4, fresh lemon juice in water. This sounds too simple, which is why it gets underestimated. Lemon matters because of citrate, one of the natural inhibitors of common calcium-based stone formation. We have clinical data in recurrent calcium oxalate stone formers where fresh lemon juice strategies showed benefit when people actually stuck with it, and the biggest limitation was adherence over time. Translation, it can help, but only if it becomes routine. We also have controlled studies where low-sugar lemonade patterns increased urine volume and, in some designs, improved citrate-related stone risk measures. So here's the kidney-smart version. Squeeze fresh lemon into water, no sugar. Because if you sweeten it, you can turn kidney support into metabolic stress. That's the wrong direction. 2 cautions. If you have significant reflux, lemon may aggravate symptoms. And protect your teeth. Use a straw and don't brush immediately after acidic drinks. Drink number 3, hibiscus tea, unsweetened. If you want a kidney-relevant effect that doesn't depend on stone chemistry, it's this, lowering blood pressure. High blood pressure is one of the fastest ways to wear down the kidney filter over years, especially after 60, when arteries stiffen and pulse pressure rises. Hibiscus has randomized trial evidence and meta-analytic evidence showing clinically meaningful blood pressure reduction. We're talking a drop that can be around 7 millimeters of mercury on average and roughly 10 in placebo-controlled comparisons in some analyses. That is not trivial. That is the difference between quiet strain and less strain. How to use it? 1 to 2 cups a day, unsweetened. If you need flavor, use cinnamon or a slice of lemon. Don't add sugar. Big caution. If you take blood pressure medication, hibiscus can stack with it. That doesn't mean never. It means watch for dizziness, lightheadedness, or falls, especially if you're already borderline low. Drink number 2, green tea, plain. Now I'm going to be precise because green tea gets oversold. The strongest clinical signal isn't from a casual cup once in a while. It's from the polyphenols delivered consistently, sometimes in a more concentrated form. There's a double-blind, randomized trial in diabetic nephropathy patients with persistent albuminuria where a green tea polyphenol preparation reduced the urine albumin to creatinine ratio by about 41% over 12 weeks, while placebo did not. And albuminuria is not cosmetic. It correlates with kidney and cardiovascular risk. Here's the honest part. That trial used a concentrated polyphenol dose, so I'm not going to promise 1 mug of brewed green tea will reproduce that number. But it does justify this. Green tea compounds have clinically observed effects on a kidney-relevant endpoint, and choosing green tea instead of sugary drinks is almost always a kidney-positive trade. Practical plan? 1 to 3 cups earlier in the day. If caffeine bothers sleep or heart rhythm, choose decaf green tea. In drink number 1, coffee. Yes, coffee, if you drink it the kidney smart way. This surprises people because coffee has been blamed for everything. But large population studies repeatedly show signals that go in a protective direction for kidney outcomes. In one major prospective cohort analysis, higher coffee intake was associated with lower risk of incident kidney disease, with a small risk reduction per additional cup per day after adjustment. That's observational, not proof of cause, but it's consistent enough to matter for real-world decisions. Here's the catch. The kidney benefit doesn't come from coffee milkshakes. It doesn't come from sugar bombs. It doesn't come from energy drinks pretending to be coffee. The kidney smart version is plain coffee or coffee with minimal additives, because the kidney's biggest enemies are often sugar load, blood pressure overload, and dehydration patterns, not the bean itself. 2 cautions. If coffee spikes your blood pressure, triggers palpitations, or worsens reflux, don't force it. And if you take diuretics or you're prone to dehydration, pair coffee with water earlier in the day. Now let me make this easy without turning your life into a health project. Morning, water first, then coffee or green tea if you tolerate caffeine. Midday, 1 cup of hibiscus tea, unsweetened, especially if blood pressure is your main battle. Afternoon, lemon water, fresh, if you're stone-prone or you want citrate support. All day, plain water as the base, sipped steadily, not chugged at night. And the most important kidney rule after 60 is not a drink. It's what you stop drinking. Sugar-sweetened beverages and healthy juices that quietly overload your system. If you do nothing else, swapping 1 sugary drink per day for one of these 5 is a kidney decision with real downstream effects. If you want this to be medical, not guesswork, track 3 numbers over time: eGFR, urine albumin to creatinine ratio, and blood pressure. Those are the levers these drinks most directly touch. And if you have advanced kidney disease, potassium restrictions, heart failure, or swelling, get individualized guidance before changing fluids. If you know someone over 60 who says, "My kidneys are fine, my numbers are just a little off," share this with them. Kidney decline is quiet until it's not. The goal is not panic. The goal is choosing drinks that lower strain every single day.